of Vitamin C month, we're having a little IV interview chat with Randi Doktor from SkinCeuticals. So I just want you to get to know Randi a little bit, so I'm going to ask her just some personal journey questions. The first one being, let's start at the beginning. How did you first get into the aesthetic world?
So I actually was working in sales and marketing, and encouraged my stepfather, who was in endocrinology, to open a medical spa, because it was that med spa boom, and kind of knowing he had such a market with a patient base with skin and hair needs for treatment. Nice. So I encouraged him, with the excess space in his office, to open a medical spa. And he was like, well, I'm gonna need your help with the marketing and advertising, which is what I did. So I was brought in to run his medical spa. And from there, that kind of like, birthed my passion for the industry. And ultimately I was like, I got hit up by a few companies to be a rep. And I was like, at first I was like, I'm never going back into sales. And then I was like, but the opportunity to help develop the medical spa brand, even through just like one line of product, but kind of take everything that I knew about like marketing and advertising and patient bundling and all that kind of stuff. So that's how I went back into the field in skincare sales, and all evolved from there.
The rest is history.
The rest is history. It's been 2 decades.
I was
Almost 20
say, is the
years.
medical spa still open?
No, actually, he retired.
He retired.
The med spa continued to thrive after I was there.
Yeah.
And it went on for a while, and then he, rightfully retired. But yes, it's about 20 years that I've been in medical aesthetics, mostly working with skincare. We had SkinCeuticals at the med spa, so.
I've been working with SkinCeuticals. I've been in the industry about 15 years, and that was one of the original products that I used and still love. But it seems like the med spa business is still booming. There's med spas popping up all over the place, and now wellness is becoming a big thing. So you used to be one of our neurotoxin reps, which inspired the switch to skincare. What drew you into SkinCeuticals itself?
Other than the job was open? No. Actually, there was a few companies. And it's interesting because I had been in skincare sales for 15 years prior to working in the neurotoxin space. And that was, I'm always looking to kind of grow and do the next thing. 15 years in skincare, should I do something new and different? And I loved working in neuromodulators and in the injectable space, but it was really one of my accounts who had known me for a very long time, who pointed out to me while I was at a meeting and how I was kind of training some of their staff on aesthetic ingredients and skincare ingredients. And she's like, my God, you still, listen to how it comes out of you. I'm like, well, I did it for 15 years. And then I left her office and I was like, or maybe it's just really where my heart and soul feels most awakened, and I joked because the positions were open, but because there was an open position at SkinCeuticals, I was like, there's a pathway here. And because I had worked with SkinCeuticals in the past many, many years ago, I knew the brand very well. And to your question of why SkinCeuticals, it really embodied a lot of what I champion representing skincare, which is science, but from an aspect of 2 things. One, if it ain't broke, don't fix it. But always evolve if there's something to evolve to. I liked that there was a lot to sink into between home care for the patients, but also treatment room modalities, and so it's this holistic approach. And I thought I missed that space, and it's okay to admit that to myself. And so that's really where it all came from, and it really felt like coming home. And I get reminders all the time that that was exactly what I was supposed to do.
And it truly makes sense that neurotoxins and skincare go hand in hand. And I have this conversation with my clients all the time. You can't just do one without the other. What you're doing at home in between your neurotoxin treatments really makes a big difference. And vitamin C is one of the first things I talk about.
I always say, and I've had the pleasure of working with a lot of injectors because of one of our product that mimics the neuromodulator mechanism of action. And again, everything happens for a reason. Had I not had all that time in the neurotoxin space, I wouldn't know how to talk to you guys as well as I do. But we always say that, the injectables are architecture. we're creating a structure and architecture with the injectables, but we still have to put a coat of paint on that building. Otherwise it's just gonna be bare scaffolding.
Yep,
So.
very true. Okay, so what's been the biggest pinch me moment in your career so far?
I think you're gonna think I'm just saying this, but I'm really not. It just happened a month ago, and it was at our national sales meeting, and I had not even completed 1 full year with SkinCeuticals, and we're at the banquet dinner where it's like the awards, and I was kind of like, this stuff doesn't apply to me. I've only been here 10 months, and I'm just here for the black tie food and dress up, and I won an achievement award, and I was so stunned, like when I saw my name and my picture come up on the screen. Like I was stunned. I was like, wait, what is happening right now? And the reason it's a pinch me moment is like, it takes a lot to surprise somebody who's been in this business, or just in life. I think at this age, it's really hard to be stunned and surprised for something that you're so humbled and grateful for. And I was shaking, and I was like, I wasn't even paying attention. Am I supposed to go up on stage like this? So and it was also my birthday that day.
Aww,
but it really was pinch me because A, it's hard to surprise people, and B, it was the universe really being like, yep, this is where you were supposed to be. And the achievement, yes, it's nice, I work hard, whatever, but the achievement I think was that recognition of like, it just comes out of my pores, pun intended.
Yeah, exactly. You work so hard, and it's nice to be recognized in that.
Yes.
Okay, so how has your own skincare journey evolved since working with SkinCeuticals? Any holy grail products you can't live without?
The evolution in skincare, I think, just comes with the evolution of like age, of my skin behaved one way 10 years ago, 15 years ago, even like 2 years ago. And this evolution of the skin is a living, breathing organism, and it's tied to your own health and wellness as we sit here kind of doing this.
Sure.
So I think, and I have the pleasure and the privilege of like learning all the science behind it for topical, but understanding how it all kind of works together. So things have changed a lot of like, I used to be the kid who was like, throw battery acid on my face, let's just dissolve it all down. And now I understand that you really have to treat it with some TLC, and that inflammation has done a lot more for aging and damage, and it's not always about the most aggressive, it's kind of a balance.
Sure.
And the approach that SkinCeuticals has to that, of that combination of, we want to do some things that are really targeted and advanced erosion, I'll call it, or those kinds of mechanisms, but at the same time we have to replace it with protection and wellness and anti-inflammatory, and just kind of embracing that. So that's really good, like how I've kind of evolved at like looking things differently through that different lens.
I love that. Any products you can't live without?
I have not lived without vitamin C in 20 years, and to SkinCeuticals credit, and I will never ever forget, it was when I was running the medical spa, and I went to a SkinCeuticals training, and actually, take it one step back, I was introduced to SkinCeuticals at a laser seminar, and they gave a gift bag with CE ferulic and phytocorrective gel, and I didn't even really know what vitamin C was that well. I started using CE ferulic and phytocorrective, and instantly saw changes in my skin. I had a hormonal imbalance that presented by way of hormonal acne, excess facial hair, things that I was constantly kind of like picking at and doing damage to my skin. And that combination of vitamin C to reduce inflammatory triggers in the skin, and phytocorrective to like really like calm those real red angry bumps. And I just quickly saw, it's like when you take vitamins and medicine, there's a response, and like your skin goes, yes, more of that. And then that really served as the gateway to bringing SkinCeuticals into the medical spa, and then at a training, learning all about vitamin C's, and I was like, oh, I can't live without this product. And I have not skipped a day of vitamin C, maybe one here or there. I will not go without vitamin C. I always say it's the bubble wrap that kind of protects your cells on a daily basis from the internal and external like forces. So vitamin C is a non-negotiable for me. And then a few other products that just sort of, again, back to the evolution of age, a product that really targets glycation and inflammation-based aging, because what that really does to the collagen and elastin structure and takes that scaffolding and kind of weakens it. So where you're gonna notice that, lower face, that's where the jowling comes in. So a product that really targets glycation and inflammation-based damage, which I call the forklift, just picks everything back up for you while being a nice rich moisturizer. And then a product with a peptide that mimics and supports the mechanism of action of neurotoxin, because it really helps sustain the benefits of my low dose tox, just because I like the look of the low dose, but I don't get the duration
A
out
little
of
bit
it.
of the microtox.
Yes,
Yeah.
more of my frontalis, we can load it up other places, and we need a little bit more in the placental soon. But for that benefit of if I'm underdosing and microtoxing for the aesthetic, I'm not going to get the full duration. So the product really helps to bolster that and give me a little glassiness as well.
I love that. What are the names of the products?
AGE Interrupter is, excuse me, because AGE standing for Advanced Glycation End Products. It is literally intercepting that inflammation-based damage and bolstering the collagen and elastin, again, why I call it the forklift. And it also has this nice rich texture that feels so great to put on at night. And PTOX is the neurotoxin mimic of mechanism of action. We do not claim to be toxin in a bottle because we are not a drug, but we are here to support the mechanism for that outer epidermal folding.
Interesting. I've not tried that one, but I'd be interested too.
And it gives a very glassy finish because it has polyhydroxy acids and niacinamide. So it's meant to do both immediate gratification by way of that. I think of like a lake that's very still. It shows up much more glassy than if the waters are a little bit choppy. So to kind of enhance that glassiness while that peptide, because it takes about 30 days for you to really get that settling out if used alone.
I like that analogy. That's
Yes.
really good. Another, I love vitamin C. I've been using vitamin C probably 20 years as well.
Yeah.
And then retinol is also key at nighttime.
I always say the ABCs: vitamin A, vitamin C, and broad spectrum sunscreen.
And then the other thing I like to talk to my clients about is, especially now at the Wellness Center, is of course we can do all these wonderful things topically to our skin, but now I want to make your insides as healthy, bright, and beautiful as your outside. So that's where we have peptides, we have IVs, we're bringing in a whole wellness program. So I'm very excited about that.
And I that's also kind of what's evolved for me, is like really understanding. We were kind of joking earlier that, you know, we talk about, oh, my eyes are puffy, my eyes are saggy, what kind of eye product can I use? But then again, it's also like, well, I'm taking in too much sodium. So there's a lot that goes on internally. Even, you know, I think I become a little bit more gluten sensitive as I age, as we all have. And I can literally see the inflammatory effects in my skin and whole, you know, so it's really understanding how it's all interconnected, and I really try to bring all that together, and it's not just about the topical, but the inner as well.
Right. We also do gut health here. We study the gut microbiome, and Jamie's been leading the way with that. She's a nurse practitioner here. So the gut is tied to the way our skin looks. We look at people that struggle with rosacea, and it usually has a gut issue that goes along with it. So interesting. It's fascinating.
I feel like that it's definitely maybe like my middle age thing. Like I could sit and talk about my gut for hours.
That's a whole other segment.
I know, right? But it's all interconnected,
Yes.
and even we see it. And I'm sure you're focusing on this, you know, where a lot of diet plays into acne.
Absolutely.
Which has been pretty popular for the last few years in that kind of understanding, but it's inflammatory. I think one of the most interesting things, speaking of vitamin C, that has evolved is, you know, we all got the memo about sunscreen.
Right.
We're good about that. What has been taking a little bit longer to catch on and is a little bit newer are things like the internal oxidation stressors on the skin. Why vitamin C's are important, why glycation is really one of the bigger triggers. And a lot of that comes from diet. I mean, we talk about glycation, which is linked to sugars in the system.
Right.
But we don't, and even someone like myself, I'm like, oh, I don't eat a lot of sugar until perimenopause hit. But prior to that, it was like, no, I'd rather eat French fries than a cookie. So I don't like conceptualize that I eat sugar, except it's in every single thing, even when you think you're eating healthy. So the interplay and the relation is like unavoidable. So.
Yeah, inflammation has become really popular as well, and we work a lot with our clients because we all have it. We all have inflammation from mostly our diet, like you said.
Yeah.
So then we talk to our clients about microdosing a GLP-1, or we have a peptide called NAD.
Yes.
We bring in methylene blue. So there's a lot of them out there that will help us to fight the inflammation inside, and therefore it will show outside.
And kind of tying into Antioxidant Awareness Month, resveratrol
Yes.
is in our antioxidant line.
Yeah.
Resveratrol intercepts that NAD pathway. So again, like working on that cascade of inflammation that's like delivering to the skin. So because the NAD is becoming really popular, and that ties to using resveratrol topically.
Yes, absolutely. It's all tied together.
Yes, yes.
Okay, let's see. You are constantly surrounded by skin experts. What's the best piece of skincare advice you've ever received?
I got this from a coworker of mine about 15 years ago, and I talk about it at least weekly. And she used to do, when she would do a training with an account and with a bunch of people in the room, and she would say, everybody go around the room and tell me what is the best sunscreen on the market. Like, forget price, forget who sells it, like, it's just the best one, what is it? And everybody would go around the room and give their guess. And the answer was, or her answer was, whatever the client will use. And it was this like reinforcement that like sometimes my favorite word, compliance, sometimes is more important than science.
Yes.
Like get them in the behavior, because I mean, I can talk to you all day long about the benefits of CE ferulic and vitamin C antioxidants. If for some reason it's not in their grasp of compliance, it doesn't matter.
Right.
But if they're going to use something over the counter,
Right.
I don't know, like,
At least they're using something.
you get them in the habit first,
Yeah.
and then talk to them about the benefits and the elevated ingredients or something. But it's something I think about all the time. Compliance sometimes wins over science.
I love that. That's really good advice. So let's get into vitamin C,
Yes.
since you just brought
Which
that
and I said this before, I can almost taste the
The
vitamin
from
C
the IV.
from this.
Yeah,
Yes.
absolutely.
It's like my brain going, yep, it's coming in. We're getting it.
So there are a million serums on the market. What makes CE ferulic or Floritin CF or any of the vitamin C's that SkinCeuticals makes? What makes them different from the others?
You sort of hit on it right there, that there's a portfolio. First, SkinCeuticals really was the first to not specifically develop vitamin C, because it had been in the market already, but we know that vitamin C is a difficult product to stabilize, which really just means difficult to get the effect that you're seeking, the cosmetic effect that you're seeking. Not necessarily that it's not stable and not safe or whatever. It's more that it's a volatile ingredient that to do what it's meant to do has to be stabilized to be delivered. So Dr. Sheldon Pinnell, our founder and godfather, out of Duke University, it really pioneered the stabilization of L-ascorbic acid for mass manufacturing and topical cosmetic delivery. And he did that by three main factors. I call it the 3 P's. pH of the product, 3.5 or below to be most effectively delivered to the cell. Purity, your pure L-ascorbic acid, as opposed to, you'll see things on the market that say ascorbic acid but not L-ascorbic, or ascorbate, or all the derivatives of. But the L-ascorbic is your pure form of vitamin C, and percentage. Anywhere between 10 and 20% is your sweet spot of anything below 10%, it's not as effective. Anything above 20% starts to become law of diminishing returns. So 12 to 15 is really like that great median sweet spot of it, but those 3 Ps are what the Duke parameters and what all of our published studies. And then the other thing you hit on, which is, so CE was out for a while, and it was understood the benefits of using that ingredient as your bubble wrap that we talked about before. But there was a lot of just the consumer appeal of a product, and the vitamin E is one of the stabilizing agents. L-ascorbic acid becomes really volatile in the whole balance of protons and electrons, and that's about as deep as the science that I can get
It's a lot of
into.
science.
especially with an IV running through me
Yeah.
right now. But vitamin E sort of donates the stability of the proton-electron balance. But it gives a little bit of a lipidy feel to the product,
It does.
which quite honestly, even when I started using it 20 years ago and was 20 years younger, I liked that. Over time, started to feel that lipidy, especially over the summer. Actually, I went to using the product every other day. Now, granted, I was a lot younger then. Now I use CE Ferulic and I'm like, oh. But at that time, that's when the company launched Floritin. And what they looked at was vitamin C is amazing, but how do we breed compliance? Because sometimes compliance wins over science. So how do we breed compliance? And what they did is they expanded the portfolio by skin type. So they developed Floritin, which didn't have the vitamin E component, but now it has an additional Floritin antioxidant derived from apples that works a little bit more on tyrosinase activity. So it's a really good pigment inhibitor. So now that speaks to clients who want a little bit additional brightening benefits with their L-ascorbic acid, but also removed that vitamin E slightly lipidy feel to it's still a liquid formulation. And then a few years later, they took it one step further and went, okay, not only do we make a lighter weight formula that became more attractive to people prone to acne or congestion, but there still is, again, always evolving and always looking at the consumer compliant base. There is actually a very legitimate patient population that can be further triggered by L-ascorbic acid with their acne. And it is independent of the vitamin E or not, it's the L-ascorbic. So they developed Silymarin, which is a product specifically designed for the real acne prone, not just oily and congestion, but actually inflammation acne prone skin type. So the L-ascorbic acid also has Silymarin and salicylic acid, and actually in clinical studies showed as effective as clindamycin with one of our other products for salicylic acid blemish control. So we have this whole portfolio, and that's where it really makes it different is we know that compliance is key. So how do you get the product into everybody's hand when it really also speaks to kind of their own cosmetic preferences?
Right, one size doesn't fit all.
Correct.
So I've been using Floritin CF forever. I loved it. CE was a little too liquidy for me, but I agree with you that there is a place for each one because the clientele they're all different.
I actually like switching. CE is my 9 month a year.
Okay.
And I like Floritin as the season changes for two reasons. One, kind of like maybe lightening up in the more hot, humid months.
Right.
But also because I do get a little bit more heat-induced pigment being out and about in the summer.
Yep.
So Floritin really serves that seasonal shift need for me as well.
I'm learning a lot.
Yeah.
Okay, so we know CE Ferulic has vitamin C in it, but what does ferulic acid actually do?
So ferulic acid was one of the key things that Dr. Fennell stumbled on in addition to vitamin E for the stability factor. So ferulic acid is also an antioxidant. It also works to neutralize free radical damage, whether that's coming from external or internal. But ferulic acid actually works a little bit more on UV radiation as well. So it's helping to stabilize the L-ascorbic acid, but also working a little bit more on the UV. So there's actually, you don't promote this a lot, just anecdotally good to know, CE Ferulic actually carries about an SPF 8. Not that SPF 8 does anything,
right,
we would never promote that. That's like if my 10-year-old self was like, ooh, it's SPF. But it has that efficacy, that alone. And that's that synergy between the C and the E and the ferulic acid. So it's stabilizing the L-ascorbic, but it's also offering a little bit more oxidative and free radical protection and works on that UV. And it's also derived, I think from oat, it's a more botanically derived, which is another thing I like about SkinCeuticals is we're always balancing science and chemistry with nature and botanicals. There's a nice little mix in a lot of our products that way.
And as a provider, always look to the science. I always want to read the white papers. I know I'm an esthetician as well as an injector, and when I put my esthetician hat on, I would always say ferulic acid, it's naturally occurring in green plants. And as they just bask in the sun all day, they don't burn up, probably because of SPF.
Yes.
So that's the protection that it's giving you.
Yes. I always think about that with algae, which is really popular in skincare, or like algae derived. And we feature them in a few of our things. And it's like, if you think about algae that are thriving on like the ocean floor. Like, how are they surviving in all that salinity and pressure and like, and it's their own antioxidant capability to survive on their own. So nature teaches us a lot.
Yeah, it sure does. Okay, so who's the ideal candidate for CE ferulic? Is it a preventative product or more corrective?
So anybody is an ideal candidate.
Yeah.
I mean, anyone's an ideal candidate for vitamin C, and I always joke that like at the age of 25, we should just be like mandated. Like, go on a vitamin C and an eye cream and a retinol.
Right.
Maybe we can wait till we're 30 for the retinol. So anybody is a candidate, and everybody should be a candidate for L-ascorbic acid. But again, we can specify by skin type if you are somebody who prefers a little bit less of a lipid feel. Or maybe it's because you're like, oh, but I'm still using my really rich moisturizer or my really additionally hydrating products like hyaluronic acid. So you want to like forego a little bit of that lipid emollients in the CE formula. You've got something like Floritin or Silymarin. So anybody and everybody is a candidate for L-ascorbic acid. And I always say, like, I will be a bully about L-ascorbic acid,
Yes.
and it's important. And to the preventative versus corrective, obviously prevention is your best correction. It's going to be more preventative. However, used regularly, you're going to see the corrective benefits of it. I can think offhand of people like to send me the before and afters, and the Floritin has also been one that people are like, oh my God, that was what unlocked that final piece of the puzzle on my hyperpigmentation. Because not only was it that elevated prevention of L-ascorbic acid, that Floritin was that one extra piece that helped like stop the communication of tyrosinase activity to it. So it has that extra correction benefit. And then you mentioned data. I'd love to point to our clinical studies on CE ferulic reduces thymine dimer cells. Thymine dimer cells are the mutated DNA that lead to skin cancer. They don't always become skin cancer, so it doesn't mean dimer equals skin cancer, but it's that stepping stone. So the presence of dimer cells in the skin mean at risk for skin cancer. And CE ferulic was proved to reduce thymine dimer cell production. So it's literally reducing DNA damage, and to me that's pretty corrective.
Yeah.
And then Floritin reduces P53, which is a melanin present enzyme. It detects the excess presence of melanin. Melanin, while we look at it as like freckles or sun damage or whatever, is actually the body's way of protecting that outer epidermis. It's like the umbrella going up. So the visualization of excess melanin means damage. So that P53 is, I call it like the Roomba. It's like to scavenger some of that damage. And Floritin reduces the P53 enzyme. So as far as correction, we're literally reducing DNA damage to the skin. So that's pretty corrective to me.
Yeah.
And I think about like, well, if we're reducing DNA damage, what's that just doing for your everyday environment for producing healthy collagen and elastin?
Absolutely. Does SkinCeuticals make a body product?
Interesting question. Not now.
Is it coming?
No. So we did.
You did.
We had a few different body products. I did really love body tightening concentrate, especially on my saggy knees. The thing with body products is they tend to be, one, a little more niche, because two, the price point. This goes beyond body correction comes at a price. Valuable ingredients come at a price. I always say price equals value. So while I loved body therapy and it had this menthol cooling sensation and it really did, you could see it on lax, crepey areas and was wonderful to bundle in with things like L-therapy and your body tightening procedures.
Sure.
It's a little more niche. And when you look at like the sell-through activity, a company like SkinCeuticals is always going to look at, stock to sale ratio and what's moving, and it was a good product and it had a market, but at the end of the day, if more of it is still sitting in the warehouse, because I always say and with any product, it's not the purchase, it's the repurchase. And a lot of times people are like, I love this product and it worked, but then they just end up going and buying Jordans at CVS. So when the repurchase doesn't suggest consumer demand is as high, not that it's not there, it's just not as high.
Right.
That's where they take the R&D and the investment and say, we're gonna look at where the market is demanding, which is in injectable enhancement products and tissue regeneration and repair. And that's for now, you know.
Of course.
They might make a liar out of me eventually. But yeah, that's where we are with body products as of today.
Okay, because I know when we talk about the benefits of vitamin C, we're talking about
Yes.
the face, and you just think, gosh,
Yeah.
I want that whole for
Yes.
the body.
Well, people do use CE Ferulic face, neck, and chest, and
Sure.
which is actually, I'm glad you brought that up because we were talking about price equals value and the value of this investment. I do always coach people that you should be using 3 drops, and if you're using more than that, you're probably overutilizing your investment. And this should last you 6 months. If you use this once a day, the 3 drops, it should last you 6 months. Now, there are a lot of people who do excess on their neck and chest and have at it because it is having that corrective benefit,
Yes.
but they see the value in doing that.
The worst thing would be when I would put it on, I'd use Floritin, and I forgot to screw the cap on, and then you would hit it and spill.
Yes. I do actually, what I say to people, and I show them the dot method, I always say, like, put it in your hand, and literally don't rub your hands together.
Yeah.
Dot. If you put 3 drops in your hand and go dot, 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 you have enough for your whole face and a little bit for your neck. But I always say, put the 3 dots in and then screw the cap back on
Yes.
right away.
Because you want to cry.
Yeah.
Okay.
I feel the chill of this right now.
Are you enjoying it?
Yeah, it's like when you said before, I'll give you a blanket. Now I know why some people probably take a
They
blanket,
get a
but
little
yeah.
chilly. What is a common mistake people make when using antioxidant serums like this one?
I just pretty much said it. I think the most common one is overusing. More is not always better. I mean, yes, if you want to hit other areas, but overutilization has a few backlash effects. One, you're wasting a little of your investment. 2, overutilization can lead to not the best cosmetic elegance and absorption of the products that follow because your skin is a sponge. It can only absorb what it's meant to absorb.
Sure.
So using too much can create a little bit of what I call an absorption traffic jam. And some people will be like, why is my sunscreen balling up on me? Because it's having trouble absorbing past the other products. So overutilization by way of quantity, and then overutilization of controversial comment coming at you. There's a lot on TikTok that is not necessarily grounded in manufacturer suggested utilization, and there's a lot of discussion about using vitamin C's at night, and science suggests once a day, daytime. Actually, there's really about a 36-hour reservoir to our vitamin C's. However, not as potent.
Yeah.
So, like, could you use it every other day? Technically, sure. But the reason we don't promote that is, do you remember which day you used it? Which, you know, and it's also not as potent.
Yeah.
But there is a 36-hour reservoir when delivered properly. The 3 Ps. When you get those due parameters and those 3 Ps, and it's really accepted to site of action, it's in there. You do not need a second use at nighttime for it.
Right.
And it's your environmental bubble wrap. So you don't really need it at night. Use your corrective products, use your retinol, use your glycolic acid, use your salicylic acid. AM protect, PM correct.
Because it is protecting us not only from the sun, but from all the other extrinsic things
Yes.
that we're exposed to on a daily basis,
Yes.
right?
Pollution, just the general assaults coming from, you know, outdoor life. I honestly, even like some of the stuff that's like kind of bouncing off your clothing,
Sure.
and my hair products that are literally against my face right now. Yeah.
So you had mentioned earlier when we started the IV that you had a little taste that tasted like vitamins, and
Yes.
it's true. That's very normal.
Yeah.
I've had people when they open their bottle, they put it on their skin, it's CE Ferulic or Floritin, they say it has a funny smell to it. So it's a vitamin.
It's fun. It's yeah. This is all kind of interconnected. I'm like,
Yeah.
I always say that's what medicine smells like. For better or for worse, you know, we have products like triple lipid, which I know is a huge with your clients. The smell of triple lipid is heavenly. We actually made a candle out of it for a promotional
Did
event
you
one
really?
time. Yeah, I kind of want to get my hands on that candle. It's a lavender rosemary. But we use our ingredients for the benefit that it delivers. If it happens to smell lovely, great. But it's funny because I also say scent is subjective, and it is tied to your palate. So one of my friends says that it smells like a forest fire. And I'm like, I don't know if that's a bad thing or a good thing. Like, I love the smell of a campfire. Yeah. She's like, it smells like a forest fire, and I love it. So scent is a little subjective. I always say, for better or for worse, that's what pure medical quality manufactured ingredients smell like. Sometimes you're gonna love it, and sometimes it's not gonna be your, choice for your like your aromatics. But I also say, like, it doesn't last. As much as triple lipid smells lovely, 3 minutes later you're not aware of the scent. Also, by the time we put on our perfume and our hair products and all that kind of stuff.
And the thing I like about it is that you are not trying to cover up with fragrance.
Yeah.
Because then again, that leads back to the whole inflammatory aspect of
Yes,
products.
right.
Which I love. Medical grade skincare is cleaner, just in general, than things you can buy over the counter.
It's funny, we actually just launched a new product literally last week, and it has no scent, and it's almost weird. Like, I think it has no scent. One of my coworkers is like, no, a little. I'm like, it's so weird to have a product that's completely void of like that olfactory thing. I'm like, how does it have no scent to it whatsoever?
Right.
So
interesting.
yeah.
Okay, so what are some real world results you've seen from people who consistently use a vitamin C product?
It's always gonna lighten, brighten, and tighten. That's the common little
My favorite.
Yes, lighten, brighten, and tighten. But again, I see so much with Floritin of like that, oh my gosh, it like literally was that missing piece of the puzzle to brightening my skin, because in all my years, I think that pigment is kind of harder to treat than fine lines and collagen and elastin.
Stubborn.
It's so stubborn, it comes back so quickly, it's so tied to our own behaviors, and there's just a little part of enjoying life, especially for people who are prone to pigment for whatever it might be, that's gonna come with things that we eat or playing tennis or whatever it might be. So that's probably one of the hardest things to treat. So I see that a lot with Floritin of like, oh my gosh, who knew that was the missing piece of the puzzle to my laser chemical peel, niacinamide tranexamic acid, like that whole program. Or even just, I really see for real, like when people get on a vitamin C for the first time and just sort of notice healthier skin, like I actually heard it from an esthetician once. She kind of opened my eyes to it, of that, especially her clients 30 and up, not 20 somethings are still so lucky with their youthful skin, but her hormonal acne and her adult acne, she would always say that vitamin C was an essential in their skincare regimen, because acne skin is wounded skin. And for a wound to repair itself, it needs to be strong. So she would always say, look, they gotta be on their retinols, they gotta be on their salicylic acids, but I also want them on the cell strengthening product so that it can help heal itself. And so I even with my own skin, that first time I used CE Ferulic, it was like a week later after I got that from the Cutera laser seminar. I'm like, who's our SkinCeuticals rep? Because I started to see my own of like, my skin is just getting healthier and stronger and able to fight its own pathways of disease pathways or whatever it is. So I see that a lot. And then Silymarin is another one of my favorites, of the ones who are like, I could never use a vitamin C, because it really did trigger the inflammation component of acne. And they're like, I can finally use a vitamin C. Oh, and I actually hear that with rosacea. You mentioned rosacea before. CE Ferulic has been really integral to that. And again, that's where the vitamin E really does come in. They weren't really able to use vitamin C's because it triggered sensitivity in the skin, and that the CE Ferulic also helps kind of control the triggers of their inflammation-based skin issues.
Yeah, so interesting. And I know when people come back, or even for myself, when I use a vitamin C, and people are like, oh, your skin looks so good. Then you're like, it is working. I'm not the only one that notices that. When other people start to notice, it's kind of fun.
Yes, I always love the ones too where people say things like, your hair color looks good. I'm like, really? Because you saw me last week and it's really the same. Or like, what's your new makeup? And it's not. It's that your complexion is radiating differently, and they can't quite place what it is. So I even say that to people, like, when you put people on a new product, sometimes they're going to text you. Actually, I love, one of my favorite texts that I got from a esthetician was when one of their clients texted them a week later after going on some of the SkinCeuticals products and said, am I just imagining this? because it was literally like a week later. And they're like, no, you're not imagining it. So I love those, but sometimes it's not as obvious as that. It's that like, are you getting random compliments on the clothes that you're wearing or how your hair looks?
Nope.
It's your complexion.
Absolutely, the way the light reflects makes a huge difference.
Yes.
Well, that's all I have for you. I want to say thank you.
Thank
So
you.
it is vitamin C month or antioxidant month, but it should be every month of the year.
I agree.
We carry SkinCeutical products. We love them. They are great quality products. If you'd like to make a consultation with anyone at the Wellness Center or any of the other offices, please let us know. Thanks.
Thank you.
Yeah, that was fun.
It's like so cold now.